I'm Melanie Swift, and I have been practicing occupational and environmental medicine for over 20 years. Throughout my career, I've focused on making workplaces healthy and safe environments for workers and the broader community. Today, I'd like to share some important information about immunizations and how they can help protect us against serious diseases like influenza, COVID-19, and even measles. It's important to understand that vaccinations in adults reduce the risk of serious infections, hospitalizations, and deaths. The evaluation for vaccine safety is exhaustive in the United States. Before the Food and Drug Administration, or the FDA, approves a vaccine for use in humans, it must undergo extensive evaluation, not only for its effectiveness, but for its safety. Vaccines work by teaching our immune systems to defend our bodies naturally. They do this without exposing you to the live pathogen. So vaccines can't give you an infection. They may make you feel run down for a day or two, and that's because your body is responding to the vaccine, exercising its immune system so that it knows how to protect you if you get exposed to those diseases in the future. It's safe to take multiple vaccines on the same day, such as, for example, an influenza vaccine, a COVID shot, and an MMR vaccine. You may feel a little more run down after taking multiple vaccines, but those side effects generally resolve within 1 to 2 days. Now let's talk about some specific vaccinations. First, COVID-19 vaccine. COVID-19 vaccine still provides protection against hospitalization, serious disease, and death. The vaccine changes each year as the variants that are circulating change. So it's important to stay up to date with COVID vaccination, especially if you're in a vulnerable group, such as people over 65 or people who are immunocompromised. Also, people who have never been vaccinated. But it's also important to take a COVID vaccine even if you have had a COVID infection in the past. The evidence shows that the combination of natural immunity from infection and vaccine-mediated immunity is more powerful than either form of immunity alone. What about influenza? Did you know that in the United States, every year, between 100,000 and 700,000 Americans are hospitalized for influenza? Some of them die. The vaccination that's provided every year, and that often changes year to year, is an important part of preventing those infections, hospitalizations, and deaths. Even if you are healthy and you're not at high risk of being hospitalized, your vaccination helps to protect your loved ones and others around you who may be more vulnerable. There are also other vaccines that you may be recommended to take because of your occupation, such as tetanus booster, hepatitis B vaccine, or the MMR vaccine. One of the most important things I've learned over my career in occupational medicine is that it's all really about prevention. Prevention is our most effective way to protect workers. Vaccinations are an important piece of what we do to protect workers, but we also need to follow some other common sense practices. Workers, if you're sick, don't come to work and risk spreading it to coworkers. Employers also need to have reasonable and compassionate sick leave policies that allow people to be responsible and prevent workplace infections. As occupational providers, we have a role to play. We can actually help boost adult immunization rates for the country by following the recommended standard practices for adult immunizations. Assess what vaccines may be needed, recommend those vaccines by educating and sharing the information that you have about their effectiveness and their safety. Administer the vaccine or refer for administration, and document that the vaccine was administered. When our workforce stays current with recommended vaccinations, we prevent needless work absence, we protect our communities, and we help to ensure a healthy economy. So how can you be a vaccine champion? Effective communication is key. Share the benefits of vaccines and address concerns candidly, and remind patients and your coworkers that protecting themselves actually provides protection for their loved ones and others around them. Become a vaccine champion. You can learn more about what you can do, including a toolkit with resources to help you, by visiting our website, acomvaccinfo.org. Be a vaccine champion today.